Hi, folks. This is Dr. Virender Sodhi with your favorite show, Your Body's a Natural Pharmacy. And today we are going to talk about the inflammatory bowel diseases, which is a kind of a heading. And under that comes the ulcerative colitis, Crohn's, and some other inflammatory disease of the bowel. But first of all, I would like to give everybody a congratulations on the happy Navaratras. The Navaratras are starting today and is considered very auspicious. A lot of functions are held in these days. These 7 or 8 days, people fast and try to cleanse, and this is the also symbolically we are winning over our own evils, and Goddess Durga has done she won the evils forces by her might, and so we also try to mimic that. And this is actually very sacred month because people fast, and so it has also a medical purpose. Fasting is considered very good medically, and our ancestors has used that fasting twice a year, one in the fall, the starting of fall, and one the starting of a spring. The fall season and the spring seasons are the best to cleanse the body. uh, Interestingly, if you look at the mother nature, we in summer there is a lot of abundance of food for the animals, and I think what we have done as a very intelligent animal, we have storage of food and we overindulge it. And but even the animals also overindulge it. And if you look at it, the animals in the summer and in the spring, there's a lot of food available for them, and they get a little plump. And similarly, we also eat excessive. So this was the best method to in the start of the fall to detoxify your body. And that's why they will leave all the grains in the Navaratras. We don't eat the traditional grains, so we leave wheat and rice, and which we call anaj, but we eat different kind of grains, and which is amaranth. And mainly people follow vegetarian diet, and the also people prohibit completely the animal protein. The buckwheat is utilized, and the vegetables are utilized. Milk preparations are utilized, give and take. So those are very phenomenally good because it really help your body to retain your vitality, you challenge your immune system, cleanse your system, and you get back to the normalcy. So this actually very interesting because our topic is about inflammatory bowel disease, but Navaratras can be very good way of cleansing your body and helping your body to get back to the normal. This whole month is full of festivities. There will be a Dashera in coming, I think, in 9-10 days, and then there'll be Diwali, which is a very famous Indian festival. So we will have some interesting functions coming up. There is also a lot of Ras Garbas and all those different dances happen in these months. So once again, happy Navratras, and you can call me at 844-301-1250. Again, the number is 844-301-1250. If you have any question regarding your health, and especially about the today's topic, which is inflammatory bowel disease. So, folks, around 1.3 to 1.6 million people are suffering with inflammatory bowel disease. Very, very common. And a lot of people suffer with it. And the sad part is that the treatment part which we have available is not the best one. So we'll talk about that a little later here. But let's first talk about what are these inflammatory bowel diseases, and the Crohn's diseases and ulcerative colitis. So Crohn's disease is basically the disease of upper intestine, but it can be all over the body. You can have from mouth to the anus, so the whole intestine can be involved. And it's also the disease of the full muscles layers of the intestine. So that means it can start from the mucosa and go all the way down to the muscle layers. So it can be a little more tricky and bad to have this disease. Then the ulcerative colitis is the disease of the surface of the lumina of the intestine, and usually it is in the large intestine. So these two diseases, they look very similar, and the signs and symptoms are very, very similar, and both are considered autoimmune disease. So what that means is that your body is attacking your own immune system. So that sounds not very fun. When you have autoimmune system disease, what that means is that your body is saying, hey, you are my enemy, and your body is supposed to protect you. So if that start attacking you, there is usually a lesser kind of help available for you. And so the symptoms are abdominal pain. People has pain in the tummy. Vomiting can be there. People has usually loose stools, can have rectal bleeding, severe cramping, weight loss, anemia. A lot of deficiencies comes along with the disease because you're not absorbing your food properly. So you end up in malabsorption, and so you end up having anemia because of your losing blood. And there are a lot of malabsorption, so you'll be low in B vitamins, B12, and you'll be low in fats because you're not absorbing. And weight loss is very common, and you also are not helping with your the whole immune system, so which leads into other problems, and which is arthritis and liver disease and thyroid disease, even going into deep vein thrombosis, and even pneumonia, which is called bronchiolitis obliterans pneumonia, are commonly known as BOOP. So this is basically a very complicated disease, and if we have this kind of disease, usually people suffer it for the rest of their life, and they can be a really not fun to have this disease. But don't give up. We have hope, and I have so many patients which has gone into remission. But again, the Ayurvedic medicine is not a single pill. This is a full spectrum, holistic approach to your mental, emotional, physical, and spiritual well-being. And if you create that balance in you, you are going to help your whole system to get balanced. Again, the number which you guys can call is 844-301-1250 if you have any question regarding today's topic or any other health conditions. So how we do the diagnosis? So the diagnosis is done usually by the the colonoscopy and the biopsy. So so in this procedure, when you have the symptoms and you go to your doctor, gastroenterologist, and he will pass a camera through your colon and try to look inside of your colon and see if this is inflamed. And then he can take some pieces of the intestine out, and then that intestine pieces are sent to the biopsy report to the pathologist, and he reads it. He cuts those pieces into small microscopic plates, and then microscopic plates are read, and then he reads if there is a inflammation and where is the inflammation, and what you can do to help that process is usually given. So what are the causes of the inflammatory bowel disease in the medical world is unknown. So nobody knows why somebody will get a ulcerative colitis. So, but I think we'll talk about what is my thought process and what is the research says about it, and how we can help to get that back to the normal. That will be in a way which we can help the whole process in there. So, folks, if you have any question, you guys can call me at 844-301-1250, and I will be happy to answer your questions. So let's have a little short break here, and then we will continue our discussion on the inflammatory bowel disease.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
So, folks, in our discussion about inflammatory bowel disease, and especially Crohn's disease and ulcerative colitis, so our body has around 100 trillion cells. I think you may have heard me saying this so many times. And we have around 1,000 trillion bacteria in us. And these bacteria, they can change depending upon where we live, the environment, and the antibiotics, steroids, non-steroid anti-inflammatory like ibuprofen, Tylenol kind of stuff. Our food chain has completely corrupted, maybe vaccination, and many, many more factors. So interestingly, people who get inflammatory bowel diseases, some of them has a history of antibiotic use even 2 to 5 years back, and that start changing their gut bacteria. And when they change the gut bacteria, it start to create a problem in their bowel and create a problem there. So basically, we have a very biodiverse bacteria in our body. And when there is a decrease in specifically certain kind of bacteria, and the scientist has realized that there are actually from the few studies, there is a decrease in special kind of bacteria which is called firmicutes and bacteroides. There's a little tongue twisting names to it. So when there is a 30 to 40% patient with ulcerative colitis and Crohn's disease has a less number of these bacteria, and so the sheer number of these bacteria in our body around 1,000 trillion, and you can see there is around 500 different species which we know of different bacteria in it, and there is a very wonderful balance of these bacteria. When we have this imbalance in these bacteria, we are creating many diseases. And nowadays, a huge research is coming out of the human biome project, and almost every disease is being linked to this bacteriological changes, including cancers, including ulcerative colitis, Crohn's disease, even mental disorders, or even ALS, MS, multiple sclerosis, kind of neurological disease, Parkinson diseases. So, which is interesting to find out that this concept is present in Ayurvedic medicine, and the latest sciences are just finding it out, and they're realizing that, wow, there is a link to it, and we can actually help once we know that this is the link, and we can find out what kind of bacteria are out of balance, and we can put it back, and that can help. So what causes, according to my research, one is maybe the use of antibiotics. And coming back to antibiotic, if you see, even I see in my clinic kids who are 1 year old or less than 1 year old or 2 years old, they are given antibiotic like discontinuously. And whenever you end up taking so many antibiotics, it is going to change the bacteria. And the more younger you are, the more problematic it is. And if you're not breastfed, you have more problem, because when you have breastfed, your immune system is triggered properly because the mother's milk and the normal vaginal delivery inoculate the bacteria in the baby. So when the baby is born, he is basically sterile. And as soon as he comes out of the mother's canal, millions of bacteria are inoculated into him. And then when he sucks on the milk, especially the first colostrum, which is the first milk, he is also getting a lot of different kinds of bacteria, and he's developing the immune system from there. And you will see that, again, the research is all pointing towards that. So the babies who are born out of the C-sections may be more prone to these kind of diseases. You have to think. And a lot of hospitals who are thinking holistically, when, there are some chances that you will end up having a C-section, because sometimes it's not a choice. If the baby is in distress or the mother is in distress, that is the only choice we left. So a lot of these hospitals, what they're doing is, as soon as the baby is born out of the C-section, they will take a vagina swab from the mother and put inside the buccal pad of the baby. So they are kind of trying to inoculate that bacteria into him. And I will encourage people, especially if you have a baby and you are going to have a baby, and you see that the baby is born because of there's some complication, and you have end up having a C-section. So keep that in your mind, because you maybe tell your doctor that, oh, no, I want that to be done. And this is a simple procedure. It's not very difficult. It just takes a one, maybe 30-second procedure, and it's very safe for the kid. So I think there is a huge link between antibiotic use and the inflammatory bowel disease. And in today's world, starting from your childhood to adulthood, we are using antibiotics so often. If you have a common cold, you give an antibiotic. You have some fever, you give an antibiotic. If you have some kind of other complications, you give an antibiotic, and that actually ruins your system. Then on top of it, that antipyretics or non-steroidal anti-inflammatory drugs like ibuprofen type of stuff is very commonly used by the adults and by the kids. I'm so surprised to see that Tylenol is used by the mother like a candy. And Tylenol is one of the biggest concern for almost everybody, including adults and the kids. These kind of medication, there are more than 2,000 death happens every year. And they also change the gut bacteria. When you change the gut bacteria, you are creating a problem. And also, people get liver diseases. The Tylenol is the number one cause of liver failure in the world. Listen to this carefully. So, folks out there who just love to pop in those Tylenol pills or ibuprofen, they should be very, very careful. Tylenol is the number one cause of liver failure in the world. So you guys, you're not helping your system. You're actually making your system more sick. So I rather use ginger powder or curcumin or turmeric or some spices to get rid of the inflammation. And there are lots of simple, easy remedies which can be done to take care of this stuff. But most of us, we don't want to go towards that. That's how we have been told lately in the last 60, 70 years. But if you look at our traditions, grandma, when you had a pain, she will make some tea for you. And the tea may come from holy basil or maybe the anise seeds or dill seed or fennel seed, or she may ask you to take turmeric powder or some other herb which has basically no side effects. But in now, what we are popping in this synthetic medicine, the body has some very severe reactions to it, and it can create a problem. And sometimes we don't see reaction immediately, but you're changing the gut behavior, and the gut behavior can create a lot of problem for you. So the antibiotic is one. Sometimes the medication, like giving too much iron, can be a problem. Iron is present in meats, especially red meat. And there has been studies available, people who eat more high animal protein. So animal protein will come from your red meat and fish and chicken type of stuff. They have more inflammatory bowel diseases. And why is that? Because what happened is the heavy use of these animal protein, there is the amino acid called methionine, which is a sulfur containing amino acid. And when you are breaking it down, you're making excessive amount of hydrogen sulfide. Hydrogen sulfide, is also called, when we were doing chemistry experiment, the hydrogen sulfide gas smells like a very putrefied, like a rotten egg smell. Usually it's called rotten egg smell. So you make a lot of hydrogen sulfide, and that is poisoning your cells, and your immune behavior is changing in the gut, and you create inflammation in the gut. When you create inflammation, so basically, inflammatory bowel disease, as the name says, is the inflammation in the gut, and that is not being controlled properly. And again, whenever we have inflammation, the body does control it. Body has wonderful controls on it. So inflammation is a very normal process, and in a normal healthy person, when the body gets inflammation, body triggers anti-inflammatory response in it, and it should take care of it. But when that responses are compromised, when that body is not able to take care of that response in your system, you are going to create some problem with it. So exactly that's what's happening inside the gut with the inflammatory bowel disease, because that the inflammation response is not getting under control. One of the other thing which I see in my clinic is food sensitivity. Again, why food sensitivity? A lot of time, I see a lot of Asian populations, and they love their wheat and they love their milk. And especially, I'm a Punjabi myself, and if you have a Punjabi, if you tell them don't eat wheat and don't eat milk, they get very upset and mad at you. And if you're South Indian, if you tell them don't eat rice, they get very mad at you, because the problem is, if they use that too excessively, that can create a problem too. But I think there is a bigger part of that puzzle too, because our food chains has been poisoned. We have so much chemicals, so many pesticides, so much insecticides in them, that carries on with the food, and that can disturb the normal balance. Think about it: if that pesticide or insecticide is going to kill that bacteria or that bug, it is also going to kill you, because it's not going to kill you immediately, but will certainly kill you slowly. And I think this may be the one of the reason. So among the food sensitivity, what I've found is the gluten and milk are the bigger culprits, and but can be many other things too. So the gluten is a huge issue right now. A lot of people having problem with the wheat and wheat family. So wheat family plants are like rye, barley, kamut, spelt. These have gluten in them, and that can create a big, huge issue. Although the gluten enteropathy is a different disease, which is related to celiac disease, but they can also be sensitivity to gluten. So they may not have a genetic defect to digest the gluten, but they may have a hypersensitivity to it, or maybe allergic reaction to it, which is a different way of reacting in the system. And they can be creating a symptoms like inflammatory bowel disease. So basically, all those things, with the altered stuff, you're creating inflammation in the gut. And as I said earlier, when you have altered inflammation in the system, body is not able to take care of this inflammation. You are creating a problem. And folks, if you have any questions, you can call me at 844-301-1250. And we're going to take a short break here, and we continue our discussion on inflammatory bowel disease.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
So the folks, again, we are continuing our discussion about inflammatory bowel disease, and special focus on Crohn's disease and ulcerative colitis. So as you know, the main cause of inflammatory bowel disease, as the name suggests, is inflammation in the gut. So the treatment is anti-inflammatory. The most commonly given drug is sulfasalazine or mesalazine. There are many different forms of it. There's a tablets you take orally. There is also in the form of enemas, in the form of a retention enema, which is given. There is also steroids are given, especially when people has a flare-ups, and it can be a lot of heavy doses of steroids, starting from 60 milligrams and then tapering it down, or sometimes people are kept on the steroids for a long time. And then there is if you're not being controlled with these two options, the next option is going into a TN-alpha. TN-alpha is a inflammation marker in the body. So what happens that you are creating this inflammation, and the TN-alpha is go out of your system, and so you're trying to block it. By the way, TN-alpha was suggested by one of our friends, Dr. Agarwal, who also has done a lot of research on spiced turmeric. and he has, I think, published more than 2,000 papers on the turmeric. And I had a good fortune of lecturing with him on one stage. And so I asked, Dr. Agarwal, so how you explain this TN alpha? So he gave me very interesting kind of Ayurvedic perspective on the TN alpha. So I'm going to share that story with you. So he's told me, Dr. Sodhi, TN alpha is like a fire, and it's like a stove, and you have a control in your hand. You can switch on the electricity or the fire, and you can heat up the things, and then the food is being cooked on it, then you control it off and you switch it off. So it's exactly every cell has a TN alpha, like a fire under the that pot in there. But if your control is off, either it's going to undercook it or overcook it. When it's overcook it, that inflammation is going to come out of it. So the TN alpha, which is inside the cell, start coming out of the cell and cause the inflammation. So that's why they're called TN alpha blockers, because they block, and there is a whole slew of these days. It is around $20+ billion industry. So these TN alpha blockers are used for a lot of diseases, including asthma, including ulcerative colitis, Crohn's disease, psoriasis, rheumatoid arthritis, and and on and on. So these drugs have potential side effect. The most common use are like Enbrel, Semisia, all those, many other TN alpha blockers are used. The another, once you're not being controlled with these three options, then you go to the next option. And the next option is to block the immune system. And the one of the drug they use is called Imuron or azathioprine. The azathioprine blocks your immune system. So as you can understand, when you're blocking your immune system, you are making yourself open or prone to many different kind of diseases. And so then another drug is also used, it's called methotrexate, which is a chemotherapy drug, which is used for a lot of different kind of cancer. And then there is another one called 6-mercaptopurine. So these are all blocks the immune system. But if you block in the immune system for a long time, you are inviting a lot of side effects. So it's not uncommon for me to see people who are on these drugs or slew of these drugs for 5 years, 10 years, even 15 years. And basically, some of them who come to me very, very late, their immune system is so short that anything passes by, they get it. And then they are feeling very hopeless. And also, especially when you're getting into TN alpha blockers and immune blockers, you're creating a lot more cancers in these patients. And people who are on steroids, they are also getting a lot of other disease like type 2 diabetes. Or they also have a weak immune system, weight gain. So a lot of symptoms will come because they are getting these drugs. So in my opinion, if we have to use it, we should use it very short and sweet and try to switch you over to the natural medicine where there is no side effects or very minimal side effects. And so these all has a lot of complications. And one of them, the complication is with the inflammatory bowel diseases, malabsorption. And also when you're taking these drugs, that adds on to the malabsorption, because all these are blocking something, not allowing the body to help the normal process of digestion and elimination. The part of the intestine, the main normal function of the intestine is to digest the food and then assimilate the food, absorb that, and then throw out the garbage part. Although which we think is a garbage is not a garbage, because that is food for the colonic and the intestinal bacteria. And a lot of bacteria lives in a large intestine, but there are also bacteria in the small intestine. But according to some studies, 90% bacteria lives in the large intestine and around 10% in the other part of the intestine. But if you look at the sheer number of it, there is 1,000 trillion bacteria, and we have 100 trillion cells give and take in a body. So you can see that we have a huge diversity, different kind of bacteria in it, and they are too many of them. And whenever we are interfering with them, with the blocking something, we are also creating the other problem. And one of the major complication with the inflammatory bowel disease, because of the disease and also the treatment, is malabsorption. So when you have malabsorption, you are not actually absorbing your nutrient properly. And when you don't absorb your nutrient properly, you are going to have deficiencies. So people can have anemia, people can have B vitamin deficiencies, people can have deficiency of fats because you're not absorbing fat, people can have minerals deficiency like zinc and selenium and magnesium. So a lot of time when I see these people, they are completely starved, they have a weight loss, and they have very less of. So sometimes I end up giving them these IV vitamins and minerals to help their immune system to boost up, and also to recover from the weaknesses due to the malabsorption. The another problem with this one is diarrhea. Of course, this is a part of the disease. So and people has so many times they go to the bathroom with this one, and when there's a blood loss, of course you're going to get more anemia. Okay, so let's have a little short break here. And if you guys have any questions, you can call me at 844-301-1250. Again, the number is 1-844-301-1250. And let's have a short break.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
So, folks, we are continuing our discussion on inflammatory bowel disease, Crohn's disease, and ulcerative colitis. So, as I said earlier, that high protein diet, especially red meat and even heavy fish consumption, has been linked to the inflammatory bowel disease, because when you are eating this food, there is a heavy amount of protein in it, and especially methionine. These animal protein has a lot of methionine, which is a sulfur compound. So you end up making a lot of hydrogen sulfide. When you make a lot of hydrogen sulfide, then that poison the cells, the normal cells, and people will end up having a lot of foul smell gas. It becomes very stinky. Whenever you have that kind of stuff, that means something is going on. So I think you should immediately try to get attention from a holistic physician, because most of my colleagues in the allopathic medicine don't know what to do with it. Although some physicians are trying to learn, and they are giving some probiotic and type of stuff which will help them, and some will certainly change their diet. But a lot of our naturopathic colleagues are very well trained, and holistic physicians who are very well trained, and they can help you a lot better than my allopathic colleagues, because they don't have enough training in this field, and they are trying to give you this symptom masking drug, which usually are not helping, are not taking care of the disease. And I will discuss some cases with you, which we have many cases of ulcerative colitis, even Crohn, who are in remission, are doing remarkably good with just our treatment. So another component of inflammatory bowel disease is the stress. So stress and gut goes hands in gloves together. Whenever we go under stressful situations, we are making a lot of cortisols. Cortisols are our flight and height kind of hormones, which is important, because when we are stressed out or we are in crisis, body doesn't want you to go away or die. So it makes those hormones so that you can get up and can do your things what you need to do. For example, if somebody is buried under the car, and there has been cases that the baby was under the car and the mom just lifted the car, and no matter, I don't know where that power came from, and she was able to lift the whole car. So that is when you're kicking your cortisols, your adrenal glands, and making a lot of those epinephrine kind of stuff, and you can do it. But if you stuck in that phase forever, you are going to have problem, because this response should be short and sweet, and then body should come back to the normal. Most of us, we are under a lot of stress from the work, from the job, from the relationships, from the migration. Like a lot of people who migrate from different country coming to a new country, especially in America or other countries, have issues because there is a cultural difference, there is a work habit difference, there is a language, there is a festival. all those kind of stuff also adds on to the stress. So I think people need to understand what is my stress and what I need to do to counterbalance it. If they cannot counterbalance the stress, that disease is not going to go. And we had an interesting discussion with the other patient the other day who suffered with inflammatory bowel disease. He's a young man, and he said, "Oh, it's my genetics." Yes, genes has some role in it, but I don't think the genes are the only cause of it. We have all kinds of different weird genes. When these genomic projects were launched, and we were so excited about these genomic concepts and the treatments, that we thought that every disease can be cured. But just to put you a little bit perspective there is a 6.4 million genes we have, half from our parents, from mother and father, 3.2 each. So now go figure it out, which one is acting out. And so there has been actually, I think, so many genes which has been related to inflammation response in the body. And so yes, we can have a genetic, but I believe, and there is a now studies available, the genes are mere expression of our behavior and food and environmental changes. So whenever there is a changes in those factors, the genes start to behave weirdly. There is a Dr. Bissell, Bissel, and she has done a remarkable studies in cancer, and she's a cancer doctor. She took the cancer cells and turn them into normal cell by changing the cell environment. So she, put some little bit of oxygen, different nutrient. That cell, which was cancer cell, became a normal cell. So yes, there are genes, but genes are not the only cause of the disease. It's the triggers, is the environment, is the epigenetics. The before genes get triggered on, what kind of environment we are providing, and that environment is provided by your thought process, how you're thinking, how is your stress level, what kind of food you put in. If you put a wrong kind of food or fuel in your car for one day, your car will become dead. And actually, it's interesting that we have a friend whose wife did it. And her BMW got completely roasted. Looks like we have a caller. And caller, go ahead. This is Dr. Sodhi.
Hi, Dr. Sodhi. This is Richa from Puyallup.
Hi, Richa.
Hi, I have a very basic question for you. I know you offer colonics at clinic. Can you talk a little bit about how colonics helps with irritable bowel disease, ulcerative colitis, Crohn's, and all these kinds of gut-related diseases? What is the role that colonics play at a technical level?
Yeah, so that's a very good question. Colonic is a irrigation of the colon with the water or some herbal medicine, or even like anemia, medicated anemia will be colonic kind of treatment. And in Ayurvedic medicine, we have done these colonics for millions of years. And there are so many different kind of anemia treatment or colonic treatment we do. So one thing is, as I said earlier, there's inflammation in the gut. So when you are using anti-inflammatory kind of approach, you are kind of changing the inflammation behavior in the gut. And we use herbs which has anti-inflammatory effects, especially like curcumin or boswellia, or even herbs like ashwagandha, or we use like a dill seed or fennel seed or trifle, which all have anti-inflammatory effect. And also we are altering the gut behavior and the bacteria. So when we are putting these things out of the gut, we are also instilling some food for the good bacteria. So the gut bacteria is in need of specialized kind of food, and we call them like oligofructosaccharides, which is present in the fruits or in the fiber of the soluble fiber of the vegetables, and even in some grain. And we also put ghee. Ghee is a butyric acid, technically speaking. Butyric acid actually helps the butyrate, and which is the colonic food. So we put also like oils like a sesame oil. The sesame oil is a propionic acid. Again, this is the food for the colon bacteria. You can also put olive oil, which is the oleic acid, and which is again the food for the colon. So we are putting the good bacteria, we are putting the food for the good bacteria. We're removing the inflammation and the toxic load. A lot of times, people are just loaded with the toxic load. They are impacted. They are having a normal bowel movement, they think, but it's not completely emptying. And now you have a bigger warehouse in the intestine. When you have a bigger warehouse in the intestine, that is not helping the whole process, and you are actually
Yes.
creating a lot of toxic load. Now it's interesting, like, there is a lot of research available on fecal implant. So what that means is you're putting a healthy poop, healthy bowel movement into that person,
Yes.
and that is like a yogurt culture. So, like, you want to make a yogurt out of the milk. So what do? You warm the milk and you put some yogurt culture in it. So when we're putting that culture, the of these different bacteria in back to the intestine, they're finding out that, like, for example, I was going to talk about that, but you asked this question earlier. For example, there is a disease which is, thanks to the antibiotic use and the hospital stays, which is called C. difficile or Clostridium difficile, and it's very devastating disease. People get diarrhea, bloody mucusy, blood comes out of the, and it's dangerous, very, very dangerous. A lot of people die with it. But when people were given the fecal implant, there was almost like a 96% cure rate, which is like a mind boggling. And the treatment for that is use of another kind of antibiotic, which is more nastier. So I've seen a lot of people with the C. difficile toxicity, and when we did the treatment to them, they got into complete remission. And there are cases after cases which we have reversed. And C. difficile is also can be the cause of disease like inflammatory bowel disease. So that's how the cloning can help you. Okay, I'm going to continue the.
Okay,
I hope
thank
this
you.
answered your question. We're going to continue with our discussion on the genetics of the inflammatory bowel disease. So basically, now if you trigger different kind of genes, you create inflammation. And so what you're doing is you're creating a lot of cytokines, which is again inflammatory molecules, and that triggers lymphocyte, which is our white cell. And so the white cell becomes very reactive. This is a normal process in the body because the lymphocytes are there to take care of the inflammation process. But now you think about, like, we have nowadays we have a lot of issues with the terrorist activities all around the world, including America and India and all over the places. And so what's going on is, when we have this terrorist activity going on, there is a hyper response. And if somebody does anything, even a minor thing, or blow a cracker off, people will start shooting. So that's exactly what's going on in the body. Your body goes into hyper response, and body will trigger that autoimmune response. Means body is attacking your own system. But again, as I said earlier, genes are just merely under control of your behavior and the food and the environment you provide. And like, for example, my mom had a diabetes, my grandma had a diabetes, my uncle and aunts in the family has diabetes. And I had made choice not to become a diabetic. And type 2 diabetes is very genetic disease. But if you take care of your body, you're not going to get it. Similarly, heart disease, there's a genetic component to it. But if you take care of your body, you can reverse it. So I don't believe that the gene theory is the only way that we should think. Yes, we may have a weakness, but if you do things to help that process, you are going to get better. So we're going to take a small break here again. If you guys have any questions, you can call me at 844-301-1250. And we'll continue our discussion after the break.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
So, folks, we are discussing today about inflammatory bowel disease and about Crohn's disease and ulcerative colitis. So, let's come back to the what you can do to help these diseases. As I said earlier, stress is a bigger factor. You might have seen when you were under stress, or as a young doctor, I remember when I was in pre-med and I was taking my exams of a medical college, we will go to bathroom very often, or you urinate very often, or you also have a loose stools because you are anxious and you're making more anxious molecules and little angry molecules in the body, because every reaction, a mental and emotional reaction on our body part, we make chemicals for that. This is an interesting discussion. There has been, like, when people are very sad, they cry, and when people are happy, they cry. Like when somebody gives you like a Oscar award and you go on the stage and you start crying. So they analyze those happy tears and the sad tears, and what they found out, there are different chemicals. Can you believe it? Different kind of chemicals for sad tears or happy tears. So body makes different kind of chemicals on every reaction we make. And when we are under stress, we are making zittery molecules like our cortisol, the epinephrine, which irritate you, and they can activate your genes indifferently. Nowadays, stress has been almost implicated in every disease. So stress is a very important factor. So you need to get rid of the stress. How you can get rid of the stress is through yoga, breathing exercise, having a good quality time with your family. Talk to, it's not just another martini which will relax you. Martini may relax you for 1 or 2 hours, and after that it will have so many side effects that you're going to have a problem with it, and maybe you need a second or third or fourth, and we go on toxifying your system. So make sure that you don't do those kind of indulgence kind of stuff, and whenever people has issues, they also indulge, and the indulging can create a more problem for us. So yoga, breathing exercises, walking. A lot of times I see these people with the ulcerative colitis and chronic or Crohn's disease, and these people are very fiery. They are kind of go-getters, overachievers, and they get angry, pissed off very quickly. They get irritable very quickly. So basically what you're doing when you're doing this kind of stuff, you are not helping your system. You're making a lot of fire in you. And remember, we talked about TNF, fire inside the cell. So when you have excessive amount of fire, that is going to irritate your gut also. And you might have seen when people get angry, they can also have a diarrhea. And because what's going on, you're making a lot of cytokines, which is inflammation, and body wants to get rid of that cytokine, so you have a loose stools. So the very important that you calm down yourself and you take a deep breath, join some yoga class, join some music class, or do some hobby. I love music. I love gardening, and so that is my ways of reducing my stress. And but it's a wonderful way of taking care of your system. Then food. Food is very important for all of us. Usually, I know what I do. We do a food sensitivity testing. We also check the different markers like inflammation marker, like C-reactive protein. We also do a special test to make a difference between irritable bowel syndrome versus irritable bowel disease. So, inflammatory bowel disease. So, irritable bowel syndrome is when people has a like constipation, diarrhea kind of stuff. Very similar symptom, but we want to make sure that if it's coming from the irritable bowel or it's coming from the inflammatory bowel. So there is a test which is called calprotectin, and that test can be done. And calprotectin test is positive in inflammatory bowel disease. It's not present in irritable bowel syndrome. So, which is a simple test will tell us. There is a diet which is called FODMAP, FODMAP, and which is like a fermentable oligosaccharides, disaccharides, monosaccharides, and polyol. So that is the acronym for FODMAP. So which means you're cutting down the food which has a lot of fiber in it, a lot of carbohydrate type of stuff in it, and so when you're avoiding, and so you're not helping the whole process of the fermenting in your system. And so basically what's going on is you have your bacteria are different, and you have a wrong kind of bacteria grown up in your gut. And when you have a wrong kind of bacteria grown in your gut, though those are actually being favored by giving more sugar. So these are all sugars: oligosaccharides, disaccharides, monosaccharide polyols. They are sugar molecules, and they feed. And if you love your candy, if you love your chocolate, if you love your sweet, or if you love your Indian sweet like a burfi or kaju katli or a rasgulla, you are ending up having problem because you're not going to help your system. You are actually feeding the wrong guys there, and those wrong guys are going to have some problem with you. So make sure that you don't do that. You cut those things out. Sugary things are absolutely no. In the mother nature, again, if you look at it, there is no sugar. All the sugar which we eat is man-made. Your sugar, table sugar, comes from a sugar cane, yes, but is highly concentrated, dehydrated form of sugar. If you have a good fortune of chewing on a sugar cane, first you have to chew this stick, and it has a lot of fiber in it. And the outer skin has a special wax in it and also has a nutrient called chromium. When you're chewing on that, the sugar cane, so first the wax comes in and then the nutrient chromium comes in. And when you have those, that is going to help with the half life of insulin double. So you are actually eating that fiber, you eating chromium, and that is going to help the sugar absorption. But when we squeeze it, we bleach it. As just for information, the white sugar, which is all over the place is available, has 3% chlorine in it. I don't know if you know that. There is a 3% standard chlorine in the sugar. If you want to eat the sugar, buy organic, not chlorinated, not bleached. To make it more white, they bleach it. And there's a 3% chlorine. So you're eating chlorine, which is not good for you. So, but I look at the food sensitivity testing because that's a more individualized approach. And this is a test where you draw the blood and send to the lab, and then lab does the testing on it. And interestingly, a lot of my allopathic colleagues put this test down, and I've been using it for more than 30 some years, and I find it right on the dot. Every time we find it so helpful. And I don't know why people don't look at that aspect, because we have patients which got better when we put them on diet. But when they went to my other colleagues and they said, oh, no, there has no studies available. This test is not standardized, blah, blah, blah. And but they said, I'm feeling good. And whenever they put those food back into the diet, they were not very happy. Their tummy acts out again. So you can see there's a very strong link between the food sensitivity and your gut. Again, talking about the microbiome, the gut bacteria, as I said earlier, the gut bacteria is everything. They are good for you. And now there is a tons of studies available on fecal implant. There has been around 40 to 60% success in many cases, which I read, with a fecal implant. So in this one, what do? You take a poop or a bowel of a healthy person, and you instill that into the rectum, or also in the hospital, what they did through the endoscopic, they put the tube down into small intestine and then put that poop in that. And I'm saying it a poop, it's a bowel basically, because fecal implant. And there has been case history published out of China. One person who has 7 years on the steroids and have complications, and when they did it almost every day, this treatment on him, he went into complete remission. And so again, if the percentage is 40% or 60%, and these people are in remission, that is still amazingly good. And I have done few of them in my clinic here, and we had one patient completely into remission, and she's, I think, 3 or 4 years into remission. And other people have got some positive result too, but they are not 100%. Boswellia, curcumin, artemisia. There's a lot of studies available on these. Aloe vera, licorice, ginger. There are spices which you can use like a fennel seed, dill seed, cumin, cardamom, which will be helpful. Probiotics, tons of different probiotic strains are available these days, which will be a wonderful help. And I have so many patients which has gone into remission with Crohn's disease and ulcerative colitis. And if you need help, we'll be very happy to help you. Or you can go to your naturopathic doctor. They will be also very helpful for you. So folks, stay healthy, and don't stress too much. Eat normal, healthy food, and I think you'll be very healthy. And the rest of your life you can enjoy, because we need to enjoy every moment of it. And thank you very much.